South Africa pulled off one of the most incredible public health victories of our time, really turning the tide against a brutal HIV and tuberculosis epidemic. But here's the twist. That very victory has created a brand new and really complex challenge. So let's unpack how a story all about survival is now having to become a story about protection.
First, let's just get a sense of the stakes here. 56,000. That's the number of people who die from tuberculosis in South Africa every single year. It's a huge number, and it's a stark reminder that even with a curable disease like TB, the fight is far from over.
And then you have this number, an estimated 8.2 million people living with HIV in the country. That is one of the biggest treatment burdens anywhere in the world. Together, these two numbers just paint this massive picture of the dual epidemic South Africa has been fighting for decades. So, how in the world did South Africa even begin to confront a crisis on this scale? Well, it took a monumental fight for survival, and it demanded a completely new way of thinking about public health. See, to fight a crisis that was touching every single corner of society, they couldn't just rely on hospitals. South Africa had to develop a totally unique and powerful blueprint for action, a truly multi-sectoral plan. At the very heart of this strategy was something called the multi-sectoral approach. And this was not just about doctors and nurses, not by a long shot. It was a pretty revolutionary idea. Let's bring everyone, the government, community groups, private companies, everybody, to the same table to design and deliver one unified health response. And the group created to lead this massive charge? That was the South African National AIDS Council, or SANAC. It was set up way back in 2000, and SANAC basically became the central nervous system, the coordinator for all these different players in this huge national effort. So who is actually at the table? Well, you had the government, of course, and this is so critical, the approach also included civil society, the private sector, and international partners. And most important of all, people with actual lived experience of HIV and TB were put right at the very center of the whole process. So the big question is, did it work? Oh yeah, it absolutely worked. Just look at this chart. It shows this dramatic drop in AIDS-related deaths in just 5 years. This wasn't just a little bit of progress. This was a monumental victory. It's proof of what can happen when everyone pulls in the same direction. But, and this is where the story gets really interesting, this incredible success created a new, totally unforeseen challenge, something we're calling the survivor's paradox. This quote, it just says it all. Because of the world's largest antiretroviral therapy program, millions of people who were literally facing a death sentence were now able to live. Survival was the first incredible, hard-won victory. And that raises a really crucial question. What happens when the system that was built to stop people from dying isn't really equipped to protect their quality of life for the next 10, 20, or even 30 years? You see, the whole fight has shifted. What started as an urgent crisis of infectious disease has now become this long-term challenge of chronic harm. The goal isn't just about preventing death anymore. It's about protecting the quality of life for all of these survivors. So what does this new reality actually look like on the ground? Well, you have people living longer with HIV on ART, which is amazing, but they're often not getting screened for things like heart disease or diabetes. People are surviving TB, but they're not getting rehabilitation for the permanent lung damage it can leave behind. This right here is the silent and really dangerous overlap between infectious disease and chronic harm. And all of this brings us to some pretty big gaps in the system. The challenges aren't just medical, either. They're often deep-seated social and psychological barriers that stop people from getting the fully integrated care they really need now. A huge one is stigma. The data from the Stigma Index 2.0 report shows something pretty startling. While external stigma, what other people think, has gone down a lot, internalized stigma, the shame people feel themselves, is still incredibly high. Let that sink in. Nearly half, 48%, of all people living with HIV report feelings of shame, guilt, or fear. This internalized stigma has a massive impact on their mental health and on their willingness to really engage with the healthcare system for anything beyond just picking up their meds. So this fear of being judged means people are really hesitant to disclose their status at work or at school. And think about it. If you can't be open about your health, how can you possibly get the holistic support you need to thrive long-term? It's a huge personal barrier, and it's made worse by clinics that just aren't set up yet for integrated chronic care. Okay, so all of this brings us to the final chapter. Where do we go from here? How does South Africa's health system evolve to meet this new reality? What does the next chapter of care actually look like? The guiding principle really has to be this.
The goal of treatment can't just be a suppressed viral load anymore. It has to be a strong, a healthy, and a full life. Like we said, survival was the victory. Now, protection is the responsibility.
And this is the main takeaway. It's a message of real urgency. If you're a survivor of HIV or TB, managing your risk for things like heart disease, stroke, and diabetes, that is not some separate task. It is the next chapter of your care. And that means if you see the signs, you have to act immediately. Do not wait. Do not assume it will just pass. Time protects your health, it protects your independence, and it protects your future. This leaves us with a final and pretty challenging question. When the line between infectious disease and chronic harm starts to blur, who is actually responsible for integrating care? Is it the HIV clinics, primary care doctors, the patients themselves, or does that whole multisectoral system need to evolve together to meet this moment?
If this conversation has helped you understand this silent but critical overlap, we really invite you to continue exploring it by following the source of this analysis, the Impacts on the Global Black Lifespan Journey, which is published weekly on AMHG Magazine.
You can visit them at mhg.ca or find them on YouTube, Facebook, and X. And please, share this explainer with your community, in your homes, in clinics, in faith spaces, and workplaces. Because you know what? Awareness is protection. Thank you so much for spending this time with us. We appreciate your commitment to understanding, to prevention, and to generational health. We will see you next week.